Millions of Americans who take advantage of the Affordable Care Act could see their health insurance costs skyrocket next year. A new analysis by KFF shows ACA premiums will increase by an average of 15% in 2026. And with COVID-era subsidies to cover premiums set to expire at the end of the year, out-of-pocket payments could grow even higher. I'm joined now by KFF's Cynthia Cox. She's Vice President and Director of its program on the ACA. Cynthia, thank you for joining us. Why are premiums expected to rise by so much?
So this is the biggest premium increase that we've seen on the ACA or Obamacare markets in many years. And part of that is just the normal growth in healthcare costs going up every year. You know, it costs more to go to the hospital, or prescription drug costs go up. But also part of it is actually federal policy. So a lot of insurers are talking about the fact that they think that the market is going to get sicker next year because people are going to be dropping their coverage due to a federal policy change. They also think that the cost of prescription drugs might go up because of tariffs, causing prescription drugs that are imported into the United States to be more costly.
And so who will be affected by these increases? As you said, some are just the regular old healthcare insurance, inflation, but the other is statutory. Who will be affected?
So 22 million people get a subsidy right now, and that lowers how much they have to pay for their health insurance each month. Pretty much all of those people are going to see their costs go up, not so much because of the underlying healthcare costs going up, but rather because they're going to get less of a subsidy. So they're going to be paying more of the total cost of the premium. In fact, what we're expecting is that their monthly costs are going to go up by more than 75%. And what we're expecting to happen in that case is that actually probably millions of people are going to just drop their health insurance because they won't be able to afford to keep it.
And Cynthia, wasn't this foreseeable? And if so, has Congress done anything? Are they thinking about doing anything?
It is foreseeable because what's happening is that there are these enhanced or extra tax credits that have been available for the last 5 years. And we knew that they were going to expire at the end of this year. Some people who had wanted these tax credits to get extended had hoped that Congress might have done that as part of the big, beautiful bill. That did not happen. There still could be time to extend those tax credits in the next few months, but they are expensive. They could cost over $30 billion a year in taxpayer dollars to extend those subsidies. So it's likely to be a big fight in Congress about whether to do that or not.
Cynthia Cox with KFF. Thank you so much for being with us, Cynthia.